Okay, so I am going to go ahead and get right into the appendicular skeleton. So again, this is the second part of the skeletal system anatomy lab. And again, these videos, you don't have to watch them, but I did put them together because I felt that it was important that you know how to pronounce again some of these terms. And for those of you that are taking anatomy for the first time, I know it's very challenging to try to learn these terms without having someone pronounce them. I also try to give you a few tricks and things that I've learned along the way in terms of kind of decreasing the amount of memorization, how to give you some of the tools to make associations so you don't have quite so much to memorize, although I know there's still a lot of memorization involved. But hopefully we can make it a little easier. So again, this is the appendicular skeleton. So we're going to be talking about the pectoral girdle and the pelvic girdle, and then the upper limb and the lower limb, to kind of give you an idea of what, again, the appendicular skeleton is. So let's get right into this. We're going to go ahead and start with the first bone. So this is going to be part of the pectoral girdle. And the pectoral girdle is going to be the clavicle and scapula. That is going to be what helps to attach the upper limbs to the axial skeleton. So the first bone here is the clavicle. And if you look here, we have the clavicles laid out just like you would see on an articulated skeleton. This would be the anterior end or the front end. This is the posterior or back end. So this is as if you could take those clavicle bones and put them right on yourself. And again, really important with these anatomy labs, if you can palpate these bones on yourself, this really helps you to remember the structures and these features of the bone. Again, the more that you could do this on yourself, you are your own kind of cheat sheet for the practical. And so if you can remember some of these landmarks on yourself, then you can palpate them. And hopefully I can give you some of those tricks as we go through along the way. So for the clavicle, you're going to see here's the sternal end. And again, you can palpate that sternal end on yourself. So you can go ahead and find that on yourself. And that is going to articulate with the manubrium of the sternum, if you can picture that here. So hence the name sternal end. Then you have the acromial end here, and that acromial end is actually going to articulate with the acromion process of the scapula. So remember that oftentimes we name the process after what it's going to articulate with. So when we get to the scapula, you can try to keep that in mind. So this is called the acromial end, and it's going to articulate with the acromion process of the scapula. So acromial end. Also the conoid tubercle. So this is where it gets tricky because I know you have the cornoid, you're going to have coracoid, and you're going to have conoid. So I know they're hard to all kind of keep track of, and just try to do your best with really trying to make the association with the bone that it's on. So conoid tubercle is going to be on the clavicles, and this is a landmark on the posterior kind of inferior underside. And you can actually kind of get at it if you kind of shrug your shoulders up and kind of push underneath the clavicle. So that's the conoid tubercle here. Conoid tubercle. Here's the conoid tubercle on this side. And here's a medial view looking at the sternal end where it would attach to the manubrium of the sternum. And then there's the acromial end, just a different view. Scapula, there's a lot to the scapula. So I'll try to go through this as quickly as I can. So if you're looking at the scapula here, it's really hard to visualize the scapula on yourself. This is an anterior view, meaning it's like you're looking through, if you had a person in front of you, you are looking through their rib cage to the scapula on their back. And so again, this would be the area of the scapula that would be up against the rib cage, if that helps. So this is the kind of front side, and then the back side here, you can't see. We'll show you in just a minute down here. So again, this is the anterior view, and you can see this part here is the acromion process. The acromion process is going to be that topmost. Acrom actually means topmost process. And the acromion process, again, is going to articulate with the acromial end of the clavicle. Then you have the coracoid process, which is going to be a process for muscle attachment. That coracoid process, coracoid also means beak-like. I know coronoid does as well. So coracoid also means kind of beak-like, if that helps you. And again, that will be below the acromion process. Then there is what's called the subscapular fossa. So that subscapular is going to be kind of on the underside, or the side. If you can remember, that subscapular fossa will be on the side. That's going to be up against the rib cage. Subscapular fossa. And then this is going to be the medial border, and this will be the lateral border. So try, if you could take this scapula and turn it around and put it on your back on the left side, it'll be easier to picture that this is the medial border and this is the lateral border. So again, this is the left scapula. And that's why I tried to make sure that I gave you left and right so that you could really visualize that in yourself. If we look down here, you can see this is actually a posterior view. So this is if you were looking at the back side of the scapula here. So, and again, this is the left scapula. So you're looking at the back side of the left scapula. You can see you have the spine here, and you can palpate that spine on yourself, on your back. So there's the spine of the scapula. Again, there's the acromion process up at the top there. Then you have, this is very easy, above the spine is the supraspinous fossa. Below the spine is the infraspinous fossa. So again, very easy, supraspinous fossa, infraspinous fossa. Then you have the glenoid cavity. The glenoid cavity will actually articulate with the head of the humerus. So that will be one of the attachment points for the upper limb. And then, let's see, again, you can see some of this. Again, this is a left scapula, so you can see some of the things like acromion process. You can see the coracoid process. You can also see the lateral border and the medial border here. So hopefully that helps orient you a little bit. This is a superior view looking down on the scapula, and you can see again, here's the spine of the scapula, and here's the supraspinous fossa. Underneath that spine would be the infraspinous fossa down here. Here's the acromion process, and then the coracoid process. Again, just a different view, the lateral view. You need this lateral view. You can get a better look at the glenoid cavity, but also you can see what's called the supraglenoid tubercle. So you'll see, it's so hard to see in this image here, but it's just this little tubercle that sticks up just a bit on the top of the glenoid cavity. And then, so if something's pointing to the top of the glenoid cavity, it's going to be the supraglenoid tubercle. If it's pointing below down here, you can see the infraglenoid tubercle a little bit better. Then that's if it's below the glenoid cavity, it'll be the infraglenoid tubercle. And those are both important attachment points for muscles, so that's why we have you know them. And then you can kind of review some of the other features of the scapula there in that image as well. Okay, so let's get into the upper extremity. The upper extremity is going to consist of the humerus, the radius, the ulna, the carpals, metacarpals, and phalanges. So again, the carpals, metacarpals, and phalanges will make up what we consider to be your hand. The radius and the ulna would be kind of your forearm, and then the humerus would be your upper arm. So let's go right into the humerus here. We're looking at an anterior view of the humerus, meaning that, remember that from anatomical position, if you could turn this humerus around, you are looking at the anterior portion of it here from anatomical position. Please remember, always remember that anatomical position is with your palms facing forward. So if you put yourself in anatomical position right now, palms facing forward. Really important for when you're doing the upper limbs. So we've got the head, which is pretty easy, the head of the humerus, which is going to articulate with the glenoid cavity of the scapula. You have the greater tubercle and the lesser tubercle. So just to orient you again, the lesser tubercle is going to be more anterior, and you can actually palpate. Please take a moment to palpate this on yourself. You can probably palpate this lesser tubercle right here on the anterior end. Then feel for this intertubercular sulcus, inter meaning between, tubercular, meaning between the tubercles, and then sulcus, again, is going to be this kind of valley in between the two tubercles. So again, we've got the lesser tubercle, the intertubercular sulcus, and then we have the greater tubercle. The greater tubercle is going to be, again, more posterior, meaning in terms of the two tubercles. The lesser tubercle will be more anterior, closer to the front. The greater tubercle will be kind of towards the back. So hopefully that didn't confuse you too much, but I'm just trying to orient you on where you would be on this humerus. So again, lesser tubercle is going to be more anterior. Greater tubercle will be, again, kind of just towards the outside of that lesser tubercle. And then there's the intertubercular sulcus. We have the, it's a tongue twister here with those three. And then you have the surgical neck here. Again, this is a common place where the humerus is broken because of, oops, I'm sorry, I just skipped through those accidentally here. Because, again, it's just a weaker spot in the bone there. Let's see, we have the deltoid tuberosity here, and the deltoid tuberosity is just going to be this little portion of the bone that sticks up here. It's for muscle attachment, obviously, for the deltoid. Then we have the coronoid fossa here. So this portion of the bone here is going to be, of the humerus is going to be the portion that makes up part of the elbow. It's going to articulate with the ulna and the radius. And if you look here, the capitulum is here, and this is going to articulate with the radius. And here, the trochlea is going to articulate with the ulna. So if you know that the ulna is on the pinky side, again, from anatomical position, then it's easy to see. And put yourself in anatomical position right now. Feel your ulna on the kind of pinky side. The ulna is that bone in the forearm on your pinky side, and then pull it back up towards your elbow. And as you do, you're going to feel these kind of two knobs on the outside of your elbow. So here on the ulna side, you're going to have the medial epicondyle and the lateral epicondyle. So the easiest way to remember those, so you don't have to memorize them, is if you know that this is the trochlea, then you know that it's going to articulate with the ulna. And so that, if you put yourself in anatomical position, then you know that the ulna is on the pinky side. And so from anatomical position, that is going to be on the medial side. So this will be the medial epicondyle. And here is the lateral epicondyle. So that on the radius side, right, it's going to be on your thumb side. And so the capitulum is going to articulate with the radius, and that is going to be your lateral epicondyle. So I hope that helps. Put yourself in the anatomical position. Really try to use your body for this practical, because again, this is where it helps decrease the amount of memorization that you have to do. So knowing that this is the trochlea, knowing that it articulates with the ulna is really key for, and this is the capitulum and it articulates with the radius, is really key for helping you to make it through some of the appendicular skeleton of this practical. Okay, so let me get back on track here. We did the coronoid, did we do the, I don't know if I did the coronoid fossa. The coronoid fossa is this fossa right here. And again, it's going to make up the elbow joint, part of the elbow joint here. So it's actually going to articulate with the coronoid process of the ulna. So the coronoid process of the ulna is going to kind of stick into when you bend your, especially your arm. If you're going to bend your arm at the elbow, that coronoid process is going to stick in that coronoid fossa. Then we have the olecranon. So now we're going to look at the posterior side of the humerus. This is the back side of the humerus. And on this back side of the humerus, you're going to see the olecranon fossa. The olecranon fossa will be where the olecranon process, that makes kind of the tip of your elbow of the ulna, is going to articulate here. So again, olecranon fossa is here. We'll talk about the olecranon process just in a moment in the ulna. And then you can review the deltoid tuberosity, again, that point for muscle attachment, and then the greater tubercle here, which again is more posterior. Again, here you can see in greater view the trochlea that's going to articulate with the ulna at what's called the trochlear notch. We'll get to that in just a minute. So there's the trochlea. And then we have the capitulum here, which is going to articulate with the head of the radius. Again, we'll get to that in just a moment as well. And so those are the two key features that will help you to know that, again, this is the medial epicondyle on the ulna or the pinky side, and this is the lateral epicondyle, which is going to be on the radius side. Please palpate these on yourself because you can feel these epicondyles on either side of your elbow. Very easy to palpate these. And again, you can see a good view of the coronoid fossa there. Here again is just another kind of close-up of an anterior view, so you can really see that lesser tubercle, the intertubercular sulcus, and then the greater tubercle that's just a little bit more posterior. And then the surgical neck and the head as well. All right, let's get into the ulna here. Also, hopefully, I mentioned that this was the right humerus. So again, I try to mention whether or not it's right or left because I know that on the website it doesn't do that. And I think it really helps if you can visualize this on your own arm. So here's the ulna, and this is a right ulna. You can see here is the trochlear notch. That trochlear notch is going to articulate here with the trochlea on the humerus. And then you can see here, this is that coronoid fossa, and that is going to articulate with that coronoid process. That's where that coronoid process is going to kind of roll into that fossa. So here's the coronoid process, here's the trochlear notch, and this here is the olecranon process, which is going to fall into the olecranon fossa on the posterior, the posterior side of the humerus. So there's that olecranon fossa, and it's this olecranon process that's going to roll into that fossa. The olecranon process you can very easily palpate on yourself. This is what we kind of consider to be your elbow, that point that sticks out from your elbow. That's the olecranon process. And then here's your styloid process. You can palpate this styloid process, palpate all the way down your ulna, and you're going to feel when you get towards your wrist, you're going to feel this little point that sticks up on your wrist on the medial side, again, because your ulna is on that medial side, and that is your styloid process. So you can actually palpate your styloid process. You feel that's the end of your ulna there. And then here's just a kind of close-up of the coronoid process, the trochlear notch, and then again the olecranon process here. And then what I like here is you can see what's called the radial notch. The radial notch is where the radius here, the head of the radius, is actually going to articulate with this portion of the ulna. So radial notch there. Okay, so now let's get into the radius. This is a right radial bone, and so if you look here, this is going to be an anterior view, again from anatomical position. The way that you know that this is an anterior view is this is what's called the styloid process. Again, you have one on the ulna that you can feel on the medial side of your wrist. It's that point that sticks up. The styloid process might not be as obvious, but you can definitely palpate it if you palpate your radius all the way down, and you can feel that styloid process is going to be a point on the lateral side of your wrist that kind of sticks out. So you can, if you palpate your radius all the way down, you're very likely to be able to palpate that styloid process. Here's the head of the radius, and remember the head of the radius is going to articulate with a capitulum here of the humerus. So hopefully that helps you visualize that. It also is going to articulate with that radial notch here of the ulna. And then you have what's called the radial tuberosity. The radial tuberosity is a good point to start in terms of making sure that you can identify the head and the neck, because the radial tuberosity is going to be on the head end of the radius. So you've got the radial tuberosity, and then you've got the neck of the radius, and then the head. And I believe that's all you need to know for the radius. Let's get into now the carpals. So now we're going to talk about kind of the carpals, which are going to make up the first portion of your hand, and also again the carpals will be what will articulate with the distal end of the radius and the distal end of the ulna to make up your wrist, the wrist joint. So if you look at the carpals, we're going to have 8 bones of the carpals. Here are all the carpals arranged in 2 rows. And there's all kinds of little memory tricks that you can use for these. I'm not going to go through all of them because you can pick whichever one you like on the internet. But I'll just go through the names real quick here. So this is the scaphoid bone here. This one is going to be the lunate bone here, and usually it's easiest if you learn them kind of in order in the rows. So the scaphoid, the lunate, the triquetrum, the pisiform bone. Then you'll learn here, this is the hamate bone. Here is the capitate bone, and then here is the trapezoid bone, and here is the trapezium. So those make up all of the carpals of the wrist. And again, there's all kinds of tricks to memorizing them, so you can pick your own, whichever one you find is most useful. Let me go through the metacarpals now. So there's your carpals. Here we're going to go into the metacarpals. And the metacarpals are going to kind of make up the bulk of your hand. And we label them 1 through 5. 1 is always going to be starting with the thumb end here. So metacarpal 1, metacarpal 2, 3, 4, and 5 is your pinky. Then we have the phalanges. And so you're going to see for the phalanges, the thumb only has 2. All of the other phalanges are going to have 3 bones. So they'll have a distal, middle, and proximal end. So you'll see this is going to be consistent with your toes as well. So your toes, you're going to have, your big toe will only have 2 phalanges, and then the rest of your toes will have 3. So I don't know how many of you have ever seen the show Bones, but this always, whenever I say phalanges, it always reminds me she was like waving her hands at a baby going, phalanges, phalanges, phalanges. So if you've seen that show, maybe that'll help you remember these phalanges, that they're called phalanges. Also, if you have your own babies at home, instead of like waving your fingers in their face and saying, oh, look at my fingers, you can say phalanges, phalanges, phalanges. And, if you want to be appropriately nerdy. So anyway, let me get back here. So as you go through the phalanges, again, the thumb is only going to have 2 phalanges. So you'll have a proximal phalanx and a distal phalanx. Here with the rest of your fingers here, the rest of your digits, you'll have a proximal phalanx, a middle phalanx, and a distal phalanx for all of these. Proximal, this is your pinky here, so proximal, middle, and distal phalanx. Okay, so only your thumb. Your thumb is the only one that doesn't have the middle phalanx. Again, just a proximal and distal. That's it. Phalanx is singular, just as a heads up, and then phalanges is plural. So let's get on to the pelvic girdle. So the pelvic girdle is going to consist of the two pelvic bones here that are going to articulate at the front at the pubic symphysis. And these pelvic bones are also called the os coxa. More formally, we call them os coxae plural or os coxa singular. So each os coxa is going to consist of three bones: the ilium here, the ischium, which is going to be kind of your butt bone here, and then the pubis you can see in pink here. Okay. And then, of course, this is going to articulate, the os coxa will articulate with the sacrum. So I think that was all I had to go through there. This is just a nice image to come back to if you want to, when we go through the os coxa, because it's a colored image, so that you can, again, come back and look at this to visualize the ilium, which portion of the os coxa is the ilium, which portion is the pubis, and which portion is the ischium. Okay. Let's get into the os coxa, because again, I think they are probably the most difficult portion of the pelvic girdle by far. So when we talk about the ilium, again, the ilium is going to be this large portion of the os coxa. And so for your ilium, you have what's called the anterior superior iliac spine here. Then you have the anterior inferior iliac spine. So those are two major easy landmarks, okay? They're going to be on the side where the acetabulum is. So anterior superior iliac spine, anterior inferior iliac spine. And so this will really help you. This is one of the left pelvic bones. If you can rotate this so that you can picture this actually on yourself. This is the anterior side here. This is towards the posterior. And so this, of course, is going to be the posterior superior iliac spine, and this is the posterior inferior iliac spine. You can also see here quite well, this is the greater sciatic notch. And that greater sciatic notch is an important route for some of the major nerves that go down towards go to the lower limb. Then we can look here. You can see the iliac crest is another major point. You can palpate your iliac crest here. So that's an easy landmark to find. So please do that on yourself. And then the iliac fossa. Here's the iliac fossa here. Really large fossa. So again, this is kind of a medial view of the bone here, looking on the medial side of it. All right, so let's get into the ischium. The ischium is what we consider to be your butt bone here. And so this portion would be the ischium here. And the ischial tuberosity is kind of what we call your sit bone. And that's what, really you can palpate that usually on yourself. And then you have the ramus here of the ischium as well. The ramus, again, being this kind of branch off of the ischium here. And that ramus is actually going to meet up with or fuse here with part of the pubic bone here. Or the pubis, sorry, not pubic bone, pubis bone, sorry, pubis bone here. So let's see, then we have the ischial spine. So this is the ischial spine here. And then just below that ischial spine is going to be the lesser sciatic notch. So again, the greater sciatic notch you saw on the iliac, or the ilium, or the iliac bone. So there's the greater sciatic notch. And on the ischium, you're going to see this lesser sciatic notch underneath that ischial spine. And just real quick, sorry, the lesser sciatic notch is important because it's a route for the pudendal nerve that is going to innervate the genitals. Kind of important, right? So then we have the pubis. So here is the pubis bone. And again, I'm just going to go back up here so you can see here where the pubis here's the pubis bone, and here's where you can see where the pubis fuses with the ischium, the ramus. This is the ramus of the ischium here. So that's what I was trying to show you. So there's the pubis there. And you can see here we have these, again, two branches of the pubis. You have the superior ramus or superior branch of the pubis, and then you have the inferior ramus of the pubis that is going to articulate, or I should say fuse, with the ramus of the ischium here. So again, here's the os coxa as a whole, and the reason that we go back, we go through all three bones, and then we go back and talk about the os coxa as a whole, is the fact that here we have the acetabulum, and the acetabulum, as well as the obturator foramen, actually consist of more than one of those bones. So if you come back up here and you look at here, the acetabulum, oh, I wish I had a better image, but all three of the parts of the os coxa are going to make up the acetabulum. So here is the acetabulum, and just in case you don't know, the acetabulum is what's going to articulate with the head of the femur, and that's what's going to attach the lower limb. So again, if you can visualize, this portion of the acetabulum is going to be from the ilium. This portion of the acetabulum here is going to be from the ischium here, and this portion of the acetabulum is going to be from the pubis. So again, the acetabulum is going to be made up of parts of all three of those parts of the bone, the ilium, the ischium, and the pubis. The obturator foramen here, we can't do this because you don't have this one in the lab, but we used to put this up, and you put this to your ear. This, if you could take the os coxa and put it up to your ear, and then you put this up to, closer to your mouth, and you use it as a telephone, and you'd say obturator, obturator, instead of operator, operator, obturator, obturator, and that helped students remember the obturator foramen. Don't know if that helps you, but because you can't actually physically touch this bone, but maybe the story will. So there's the obturator foramen. It is the largest foramen in the skeleton, yet nothing large actually passes through it, so kind of ironic. Then we have the articulated pelvic girdle. There's a couple features here that are important, especially for identifying the male versus the female pelvis. So if you look here, here is what's called the pubic arch. So as you're going to see in a moment, a pubic arch like this would be female because it's greater than 90 degrees. And then here's where, this is called the pubic symphysis. So this is where, it would be joined by cartilage in between these two portions here of the os coxa. So then we have what's called the sacroiliac joint here. So this is going to be where the ilium joins the sacrum. So hence why we call it the sacroiliac joint. So that might make a little more sense now when you hear that term, sacroiliac joint. Again, joint between the sacrum and the ilium portion of the os coxa. Then we have what's called the pelvic brim here. And the pelvic brim is important, obviously, because this is the birth canal. So obviously the pelvic brim is going to be larger in a female, larger and wider in a female than it will be in a male. When standing, you're going to see the pelvic girdle and the os coxa are actually going to be tilted. And so they're tilted anteriorly so that the anterior superior iliac spines here and the upper end of the symphysis pubis are going to lie in the same vertical plane. So again, just kind of important if you can kind of visualize that. So that's how much the os coxa are actually tilted, and the pelvic girdle itself is tilted anteriorly when you're standing. helping you to be able to distinguish between a male pelvis and a female pelvis. Really briefly, I'll go through some of, you can look at your textbook for more of that kind of illustrations and comparisons. I know you're going to go through this in lecture as well, but really briefly, it's very easy to see when you have them next to each other, a little more difficult when they're not right next to each other. But one of the first things I look for is, again, if you have this kind of V-shaped, you can see that the pubic arch here. So here, remember we said that pubic arch is going to be a feature that is going to come back here when you're identifying the male versus the female pelvis. So here is that pubic arch, and again, it is a less than 90 degrees or less than in the male, and then it's going to be greater than 90 degrees in the female pelvis. And you can see it's also more rounded in the female pelvis. So again, that's one really kind of obvious feature. Another obvious feature, looking at the pelvic brim, you can see obviously the pelvic brim of a female is going to be wider, and that of course is for the purpose of childbirth. You'll also see that the sacrum is actually tilted posteriorly. So again, allowing for a much larger pelvic outlet. And here you can see the sacrum in a male is actually tilted more anteriorly. So again, just a couple quick, easy features for you to be able to identify the differences in, sorry about that, the male versus female. All right, so we'll go ahead and get into the lower extremity. The lower extremities are going to consist of the femur, the patella, which is your kneecap, the tibia, the fibula, the tarsals, metatarsals, and phalanges. So let's go ahead and dive into the femur here. Again, the femur is that large bone that you can palpate very easily, the upper portion of your leg, the upper portion of your lower extremity there. And you're going to see here is the head of the femur. Obviously, that's going to articulate with the acetabulum of the os coxa. You can't see it here, but you can see it in another image here in just a moment. You'll see what's called the fovea capitis. The fovea capitis is where a very important ligament called the ligamentum teres attaches the femur to the acetabulum. And when they, kind of interesting fact for you, that when they do the hip joints replacements, so when they do the hip replacements, the prosthesis are actually held together by the surrounding muscles inside because they don't have that ligamentum teres in place. So again, there's the head. Here's the neck of the femur. You can see that here. Then you have what's called the greater trochanter. Here's the greater trochanter, really easy, large feature on the femur to identify. So greater trochanter, lesser trochanter. And this is the anterior surface. So this is the right femur. So if you could turn this femur around and put it up on your right leg, you might be able to kind of visualize that on yourself a little bit easier. So again, there's the greater trochanter and then the lesser trochanter here on the more medial side. Here again, so you can, if you could visualize this on yourself, if you could turn this femur around, you can see this is going to be the medial epicondyle. You can palpate this on yourself. This is going to be the lateral epicondyle. Epi being above the condyle. And that, so you can palpate that on the sides of your knee there. And then the lateral condyle and the medial condyle are going to be the surfaces that are going to articulate with the tibia and fibula. In just a moment, we'll show you that. And I believe I got all the features in that one. Just want to make sure. Oh, patellar surface. I missed the patellar surface. So here, especially on the anterior side, this is where, again, the patella will sit here. So kind of an important feature, patellar surface to know on the femur, on the anterior side there. Okay, so let's go ahead and look at a posterior view now. So on the posterior view, again, you can see some of the same features, except for in this one, it's really nice because you can finally see the fovea capitis, again, where it's going to attach to the ligamentum teres. Again, the head, the neck, here's the greater trochanter, lesser trochanter. Again, to the right next to the lesser trochanter, you can see what's called the gluteal tuberosity. and it'll be this kind of just, again, small bump on the bone here, and that's going to be for obviously attachment of the gluteal muscle, gluteal muscles, excuse me. Here's what's called the linea aspera. Again, another very important feature for muscle attachment. So it's going to look like this line going down the posterior, excuse me for that, the posterior portion of the femur. Again, now you come to the medial and lateral condyles. So remember, here are the epicondyles that you can actually palpate on the side. The medial condyle and the lateral condyle are going to be the actual tween. So medial condyle, lateral condyle, intercondylar fossa. This is just a quick view of the patella, the right patella, left patella. Some of the tricks we use for this you can't really use because we don't have the patella there for you to lay down on a surface. So here's your right patella, here's your left patella. Here's the posterior view of the patellas. And really, it would be very difficult to tell the right versus the left patella without actually having it in front of you. Here is the tibia, and so you can see that the tibia is what's going to articulate with the medial and lateral condyle of the femur. So let's go ahead and go down here. You can see here's your lateral condyle, and here's your medial condyle. And so these are the portions that are going to, again, articulate with the femur. And then you have, so lateral condyle, medial condyle. And the easiest way you're going to ask, how in the heck do I remember looking at this? What's the medial and lateral side? To be honest, I find it's easiest to orient off of what's called the medial malleolus. So I want you to go ahead and palpate right now down your tibia. And as you palpate down your tibia, you're going to see, you can kind of follow it down all the way to the very inside of your ankle, to this kind of really, this protrusion, this portion of the bone that really protrudes out on your ankle. And that's called the medial malleolus. So if you can remember that, or if you don't remember and you palpate your tibia, you'll see that that's going to end up pulling you down to the medial malleolus. And so that medial malleolus is where I orient off of. So if you know this is the medial malleolus, this is the medial condyle, that's the lateral condyle. And you can feel on either side of your ankle these two protrusions. Okay, the one on the medial side, the inside of your ankle, is going to be the medial malleolus. That's to the tibia. The one that's going to be on the lateral side, we'll talk about in just a minute, that's the fibula. So again, this is a right tibia. And this is the anterior view. You also have the tibial tuberosity. Again, tibial tuberosity is this protrusion here, very important for muscle attachment. So, and then you can see this is called the intercondylar eminence. So the intercondylar eminence, again, will just be the portion that goes in between here. It sticks up and goes in between the intercondylar fossa. When you look at the fibula, so here's the fibula. Fibula, again, is going to be the bone that's more lateral. Tibia is more medial. Fibula is more lateral. This is actually a lateral view of the right fibula. And you can see here's the head of the fibula. And then here's the lateral malleolus. So again, as you palpate down the outer side of your leg, you can feel portions of the fibula. Fibula is a little harder to palpate, but you can feel, especially on the distal end, you can feel the fibula, and you can palpate it all the way down to that lateral malleolus on your ankle there. And so that lateral malleolus is very easy to palpate. This is your lateral malleolus, and then on the underside of this, which is not depicted, I'm sorry we don't have an image of the underside of the fibula here, but there is a large fossa here, and that would be the malleolar fossa. All right, so let's go ahead and get to the tarsals here. So I'm sorry this is long. I'm trying to be as brief as I can. As we go through the tarsals are going to be kind of what we consider to be your ankle bones, right? And you've got the largest one is going to be the calcaneus. This is the calcaneus that makes up your heel bone. Calcaneus. Here's your talus. So talus is going to be the portion that articulates, again, with the tibia and the fibula here, and that's going to make up your ankle joint. So talus. And then as we go through the rest of them, these actually are not too bad in terms of the tarsals, not as hard as the carpals. So for your tarsals, again, calcaneus, you have the talus here sitting on top. And then here, if you can remember, navicular and cuboid are here. And these other ones are easy. Then there's the lateral cuneiform, the intermediate cuneiform, and the medial cuneiform. So those are all pretty easy. Medial, intermediate, lateral cuneiform. And then you have cuboid, navicular, and then you can just remember talus and calcaneus. Calcaneus is, I think, kind of easy to remember for being, again, the heel. So hopefully that's not too bad. Here's your metatarsals. So again, your metatarsals are going to be kind of your major 5 foot bones, starting at 1 and going to 5. 1 again is going to be your big toe, and going to articulate with your big toe, and then 5 is going to articulate with your little toe, if that helps. So 1, 2, 3, 4, 5. And then as we go through to the phalanges here, so your phalanges, same term that's used for your fingers is used for your toes, phalanges. And just like with your fingers, you have the just 2 phalanges for the big toe, just like your thumb. So you'll have proximal phalanx and a distal phalanx. And then for the other toes, all the other toes, 2 through 5, because we label them 1, 2, 3, 4, 5. So 2 through 5 are going to be the proximal, middle, and distal phalanx on each one. Proximal, middle, distal, proximal, middle, distal. So that is it for the appendicular skeleton. Please let me know if you have any questions. I know that was a lot and it was fast. So feel free to email me, and I apologize. I did these videos back to back. So by the end of it, I'm a little tongue twisted, but hopefully they really help you in terms of, again, the pronunciation for these.